most people with diabetes are really interested what's the effect of alcohol in diabetes and how much alcohol they should drink it. I think our policy is to not to recommend alcohol at all in diabetes. We do not recommend drinking alcohol in diabetes, and we should be very clear on that. And this video is about those people who continue to drink and those who wants to drink and can enjoy the drinking as long as they have the safe limit. And right at the beginning, I must tell you that if you're drinking alcohol, do not drive and do not operate heavy machinery or any work which required precision of work should be avoided. So it's very important to understand that when you're drinking alcohol, it's a toxic substance, it's an addictive substance, it's harmful to the liver. The beneficial effect, what's been told, are usually in a very small quantity if you're taken. And the most important that the quality of alcohol should be good, and also important that it's very important to see how much you are drinking and how often you're drinking. If you're drinking daily, you should completely avoid it, and you should at least have 2 to 3 days off. And if you're drinking throughout the day, make sure you don't drink throughout the day. So it's very important to understand what sort of alcohol and how much alcohol you can drink. So the best thing is you do not drive, make sure you don't drink daily, make sure you drink the right quantity of amount and the right amount of alcohol and the good quality of alcohol. And if you're drinking alcohol, be in the safe limit, and that may benefit your heart. There's a small evidence, and the limits among males and females are different. And we describe alcohol in units. So the standard glass of wine is 200 ml of wine compared to the standard amount of any red, white wine and champagne, something around 200 ml of alcohol is equivalent to 1 unit compared to 25 ml of a whiskey. Any spirit which includes gin or vodka is 1 unit. And 25 ml is a very small amount of thing. Normally a pub measures is something around 25 to 30 ml. So you should be very careful about, and you should have always a measuring flask to measure your 25 ml of alcohol. An average beer, in India sometimes we have very strong beers, I'm talking about average beer, something around 300 ml can have 1 unit. If it's strong beer, can have 200 ml of beer, can have 1 unit. So an average beer is around 300 ml and 1 unit of alcohol. Also, it's very important to understand that you should not limit total of 15 to 16 in a female in a week and around less than 18 in males, and do not drink daily. And it should be not binge, it means not all 15 units of alcohol or all 18 units of alcohol should be consumed in a single day. Now, there's always about alcohol and calories as well. So it's very important to understand that the spirit have around 50 to 60 calories if you're drinking with water or soda or ice. Compared to 300 ml of beer will have 150 calories. So in other words, if you're drinking beer, if you're overweight, there's a chance that your calorie intake would go up further. So if you have 3 measures of spirit or whiskey, will have around 150 calories, but as far as beer is concerned, you can have 1 glass of 300 ml of beer would have around 150 calories. Similarly, the average glass of wine, 175 to 200 ml, may have something around 150 calories per glass. So the beer and wine have little more calories. We do not recommend switching to whiskey, but you should be careful about your calories, because ultimately if you're drinking large amount of calories through beer or wine, it adds up to your carbohydrates and it can also cause weight gain. But yes, spirit, small amount have less calories. But again, the limit should be used. You should not be drinking more than 1 or 2 units in a day, and total around 15 to 18 units a week of alcohol in a week. And it's very important to have a few days off. And it's very important to get in touch with the doctor and physicians about your liver function test. If you have any disease like alcoholic cardiomyopathy or alcoholic liver disease or any sort of liver disease, you should not drink any alcohol. If you have any on blood thinners, if you have any warfarin medications, you should consult your doctor and you should stop drinking alcohol completely. And that's not been said about the effect of alcohol on blood sugar. no particular person will have same sugar levels when they drink alcohol. Some people can drink large amount of calories with alcohol, so they can find their blood sugars going up high. The effect of alcohol can also cause low sugars. If you're especially taking large amount of alcohol, you're more prone to hyperglycemia. So we strongly advise to check your blood sugars at night if you have taken a large amount of alcohol. If you have not taken any intake, then you're much more risk of hyperglycemia. So in per se, you should worry about the low sugars and the high sugars, and ultimately high calorie intake will also adds up to calories. And the amount of mixes what you drink with alcohol, including the normal Coke or anything which has got sugary drink, will add up to calories. So you need to be careful about your blood sugar levels. Keep checking your blood sugars, high alcohol intake, be careful, be watchful about the low sugars as well. So in summary, alcohol we do not recommend. If you drink alcohol, take in small quantity. You should know how much units you are drinking. You should have at least 2 to 3 days off of alcohol, and it should be in a safe limit. Never drive with alcohol at all, and make sure you don't have liver or any disease which can affect your disease process by drinking alcohol.